A warm welcome to A Nurse's Lift to Work with Tina and Kate, coaching podcast by two healthcare professionals. We are friends, we are nurses, master NLP coaches, hypnotherapists, parents and business owners. We are busy people juggling many things just like you.
You are in for a treat. We will chat about informal coaching tips, coping strategies, and how to effectively change your mindset and have some fun along the way. So, hop on board with us for A Nurse's Lift to Work.
Hello everyone and welcome to A Nurse's Lift to Work. I'm Kate.
And I'm Tina.
And today we have a lovely guest called Jo. Jo, please introduce yourself to our listeners. Tell us a little bit about who you are, what you do.
So my name is Jo Tyler and I am a mental health nurse by background. I still work within the NHS and I currently work as mental capacity at clinical lead. I also run my own business as an alcohol transformation coach, which has come as a consequence of nursing. So that's, shout out to nursing. But yeah, that's me. I'm 50 years old. I'm married with 2 kids and yeah, that's it.
Amazing. So tell us a little bit more about your job, your clinical job.
So my clinical job is I work with mental health staff, with district nurses, with doctors, consultants, paediatricians, podiatry, dentists, and look at how we implement the Mental Capacity Act. And so it's looking at assurance, it's looking at as a care trust that we are assured that we're using the Capacity Act correctly. It's making sure that we meet the CQC standards, that all the policies are in place, that all the different policy authors think about the Capacity Act when they're writing their policies. I love clinical practice, and I've been very fortunate with this role that I've really been, my manager's amazing, really, really good, and I've been able to make it my own. And because I'm very clinical, I often get involved in clinical cases, in really different complex cases, going onto the ward, supporting staff. I went out for a day with district nurses, and honestly, this shows my naivety, I suppose, as a mental health nurse. I went out for the district nurses only ever seeing, like, what's that program called on the telly where all these, it's like, it's just as, this is the menopause. I apologise, my brain. But it's where they go out, and it was a district nurse, like a soap or something. And I thought, oh, it'll be lovely. We'll just go out and have nice cups of tea with people. Oh my God, it was nothing like it. I hated it. Didn't it show the difference of nurses? Yeah, but I do a lot of clinical work. I support that a lot and get a lot of clinical calls, which is what I love. Go to a lot of meetings, do training, deliver training, lots of different things.
Do you work primarily in a mental health trust, or are you in an acute trust as a mental health nurse?
No, it's primarily a mental health care trust. Mm-hmm. Yes. So a lot of my work is with mental health staff because I feed back through our mental health legislation committee, through our clinical board, and a lot of the focus is around mental health because we are primarily a mental health care trust. Yeah.
Oh, that's Jo. That's great because I'm a fellow mental health nurse and general nurse as well. So it's always nice to talk to a mental health nurse. So when did you have that light bulb moment then when you thought, yep, nursing is for me? What brought you to nursing?
Well, I always, as a child, wanted to be an actress, always. And my parents were supportive. My dad in particular was always, because all the teachers at school and stuff were like, 99% of actors don't make it, 1% do. And my dad was like, ignore them. If that's what you want to do, go do it. Somebody's got to make it. If you've got a good work ethic, all those stuff. then very sadly, when I was 17, my dad developed lung cancer and sadly passed away. And I was at that point finishing A-levels, wanting to go to drama school. So I auditioned for a drama school in London, did really well with the audition and got offered a place. So went to live in London at 18 on my own, having just lost my dad. I think because I kind of at the time thinking I really wanted to be an actress, but also I really wanted to do it because my dad really believed in me. So off I went to London, probably not in the best state of mind, went to some amazing parties, and pretty much that's all I did. And then thought, I'm not really, it just wasn't the right time for an 18-year-old to be living on her own in London. But I'd had no plan B. So I came back, and my mum's best friend, who owned at the time a nursing home, I had no clue what I wanted to do. People had said to me, be a nurse. And I remember going, why would I want to be a nurse? I can't imagine anything worse. But I went to this nursing home literally to give me something to get out of bed for in the morning. And just went on a morning, wasn't even getting paid, and spent time with the old ladies. And I loved all the ones that nobody else liked. I loved them. Like one lady that kicked other people and shouted, and I just really found people interesting. I really liked it. And then I thought, oh, so I got a job then as a care assistant and thought, you know what? I don't want to be a care assistant for the rest of my life. Thank you very much. I want to be a nurse. And it was from then, and liking all the people that nobody else liked, because I was intrigued by them and I wanted to understand them and I wanted to make them feel better. And I didn't just want to be annoyed with them like everybody else. And that, hence, and I remember thinking, and this is, and I still feel like this, you know, I remember thinking, oh my God, I found something in my life that I found my purpose in my life, and I wasn't even looking. I found this purpose, and I still felt like, oh my God, I could never be a nurse, in that I dual trained. I was never trained as a general nurse. Like, you know, stuff makes me a bit squeamish, but mental health, oh, I love it. And that's how I ended up in mental health. And never worked with older people again. Sorry, you'll have to tell me if I talk too much.
No, it's fine. Joe, I'm just going to say I love your passion. And the thing is, when you find your purpose, and Tina and I, we have done a podcast on this. When you find your purpose, you know, and you can't help. You can't help but like shout it from the rooftops, because you kind of want everybody else to feel the same way, to have that enthusiasm. And especially for any newly qualifieds that we've got listening, or maybe staff that are just feeling a bit jaded. Remember your purpose. It's in there, and it will shine. It will shine through.
And I think we all have to remember in nursing, you know, there's ups and downs. There's always ups and downs. You know, I've had times that I've really struggled, you know, when you're short-staffed, but I think there's always a reason. And I remember the first job I did, I took my last placement in my third year. My last placement was at a unit. It was awful. It was called Treating the Untreatable, and it was a private unit, and it was women from all over the UK, from different prisons, that basically nobody could do anything with severe personality disorders. And yeah, and it was called Treating the Untreatable just says it all. It was just awful. And I went and I worked there. I went and I got offered a job there, and I took it. And the manager at the time said, literally, this is honestly, it wouldn't happen now. She said, when we opened, we lost 14 staff in the first 2 months. So I got in women who fight in pubs on a Saturday night, and that is what she'd done. It was horrific. But I loved the patients. I loved them. I loved the work. And I couldn't get over that we could treat somebody, because it promised the earth and it gave nothing. You know, these local authorities were just paying thousands a week and everything were promised. They got nothing. These ladies, it was just awful. And I remember one night we were sat having this takeaway. It was a night shift and we were having a takeaway. And there was one of the ladies, one of the patients sat with us, and she was watching us eat. And at the end, one of the staff cleared everything up, and I was like, "Oh, do you want any? Yeah, you're going to share some with us?" And they were like, "No, don't let her having it." And I was like, "Right, this stops." And this girl that they were being so mean to, her parents used to have like six, I think there were six siblings, and they used to feed them like cat food with a spoon one after another. And they had staff in there that could be that mean to somebody. And they were violent and they were distressed and they were difficult to manage, but that stemmed my interest in personality disorders. And all my career I worked with I think they get such a raw deal, and I loved the work and I loved the patient group, because how are you supposed to be when you've been through so much trauma in life? How are you supposed to be? How, it's there for the grace of God go I. But the staff were mean, they were not nice. By that work was so important to me, because I wanted to do better. I was like, we have to offer something better than this to people who are severely traumatized. There has to be more. And that stemmed the interest in my career, in working with people with difficulties. So even when you're in the wrong environment and you're like, oh my God, this is actual hell on earth. And it was hell on earth because of the staff, not because of the patients. Something can come out of it in the end. It's about reflecting and learning and getting the right support and understanding that, okay, once I qualified, I worked there for 6 months. I didn't work with another nurse again. I was literally on my own. I was like, oh my God, I couldn't even write a care plan care. I was like, I had no clue. But I relied a lot on me, my personality. I think you do in mental health, don't you? And yeah, I survived it. And it was a really good learning experience in that. It made me want to do better, want to do more. I'll stop talking now, sorry.
Jo, it's so interesting, isn't it? Because I think a lot of nurses would have had placements or situations in which they would have been with other colleagues and they're thinking, I don't want to do that behaviour. Of course, you're talking about something historical like Winterbourne was that kind of situation, wasn't it? And I think nowadays we try so hard, don't we, to encourage people to whistle blow, to kind of, there's a proper phrase for it, isn't there? To go to your speaking up guardian. That's the word I was trying to find in my head. Speaking up God, so if we've got listeners and you're thinking, oh my gosh, actually I'm really tuning into what Jo's saying and I'm in a situation where I'm really uncomfortable about the way people are behaving around me to patients, do find your courage and go and talk to somebody. But the other thing that can happen, of course, is that as our careers go on, we take from that I'm not going to be that nurse, I'm not going to be that person. So sounds like that's what happened for you. So you've been in some crazy situations and sounds like your day-to-day job might be quite, stressy at times. So what gets you through those crazy shifts then? Is it coffee, chocolate, something else? What do you do to look after yourself?
My job now is really not stressful at all, really, because I'm not on the front line. So even when when you're involved in difficult cases or complex cases, it's more, I'm having that discussion with somebody who's involved, and I've got time then to go off and have that conversation. I think when I've been working on the wards, my whole time on the wards was spent working in low secure care. And I think that's because of my experience with these ladies. And for anybody thinking about secure care, I've been a ward manager in acute wards and community and things, but my nursing experience has all been secure care. And I think within that environment, I loved that. I loved it. And in terms of finding, you work so closely with people. You're behind all these locked doors, and you work so closely. And it was the staff team, I think, that got you through. The staff team, that you are there for each other. It's a really close community, and supervision. Supervision, allowing yourself to make mistakes, saying, okay, I've made a mistake here, or I could have made a better decision there. I think we've always had debriefs. It's going home or going for a run. I meditate a lot. I love meditation, things like that, really. And it's all the basic stuff, isn't it, of looking after your basic health, physical and mental health. So crazy busy shifts, you don't get time to go for a wee, let alone eat lunch. But actually, it's making that time that you do, or that you say to someone, I'm actually struggling for 5 minutes here, I just need a minute. And it's them conversations, and never feeling, and asking again and again and again. If you think, I should know it, it doesn't matter. It's about asking and being in that supportive environment. That, I'm not sure I've answered the question there, but
Wow, it's really helpful things that you said, isn't it? Hey, what would you like to ask Joe?
You already talked about your meditation,
yes.
and I am a big advocate of it as well. Is that your kind of go-to when your day's got a little bit much, and you want to scream, or do you have another coping mechanism, for want of a better word?
Meditation is something I do every day, and I know that impacts my mental health and helps me stay on a level. I suppose I've got a really busy mind, as you might be able to tell. I've got a really busy mind, and sometimes it's difficult to switch off. So actually, to manage that, I use meditation on shifts. If you're really busy, I worked with a lot of similar staff for a long time. To me, it was always them strong teams of, sometimes, and it's a balance, isn't it, between not, and I've been in some handovers, and you hear how people talk about patients, and you're like, hang on, this isn't right. It's not about being disrespectful or about but actually, we talk a lot, don't we, in mental health, about transference, about counter transference, about how you might feel in response to somebody. So actually, sometimes I remember going into a nursing office and saying to the ward manager at the time, I just want to scream at that person. I want to scream. I want to say, why have you? And he was like, okay. And he was like a father figure. He was like, okay, in a really calm voice. Okay, Joe, so how can you say that in a really respectful way that's going to, be that and help the patient, like, can help you? And it's about having that freedom, I think. I've always been fortunate. I've had people I could go to and go, oh my God, because you know what? Sometimes you need to do that. Sometimes you need to just go, oh my God, with probably a few swear words in there. This is just awful. There's times you'll know, Tina, when you've worked on mental health, was if you've found somebody like ligatoring, or you found there's blood everywhere, or something really distressing. And when you're nurse in charge, you very much keep in control and you deal with it. But afterwards, your legs go to jelly, you might be tearful, you might be upset, and that's all right. I think for me, it's always been about learning we're not superhuman, and that is okay. And that is okay to feel, and it's okay to demonstrate that. But it's about making sure the environment's safe as well. But I've always been very lucky, and I know not everybody is, in that it's felt like safe environments where I've been able to have those conversations, or say, do you know what, I'm feeling crap here, or whatever it might be.
So when you get home,
Yes.
what's your guilty pleasure?
God, God, do you know?
Now, I see that this, I know that this is hard because I also know that when you finish work, you do your business work as
Yes.
well. So that aside,
Yeah. Probably walking, getting out and having a walk. I really like to get out and have a walk, and get out in the fresh air. That really helps me. Yeah, sometimes eating rubbish, sometimes just watching a bit of telly. Conversations, nobody in my family is, in my immediate family is in nursing or medicine or anything. So sometimes coming home and just talking about something completely different. And you're getting home to a busy house, get home to kids and to my 18-year-old, my 11-year-old, and you get home to busyness, don't you? And you sort of crack on. A bubble bath. I love a bubble bath, and candles sometimes. Yeah.
That all sounds delightful, actually. But obviously, you said at the beginning, Joe, that you do have this other business and you're a nurse who coaches. So tell us a little bit about that.
I was really lucky that the NHS, our care trust, were looking for people to train as a coach, and I was, given that opportunity to train as a coach. And of course, like with anything in the NHS, it's always the best. They want to have people right, don't they? I suppose. So I coach some staff within the NHS, within our care trust, about numerous things, really, about their careers, their jobs, sometimes their home life, different areas. And then I also coach women with alcohol issues, and that came from, so a lot of what I do, and this is pre-COVID, was training people. And part of the Capacity Act, it comes from the Human Rights Act, so it's about unwise decisions. And do we have the right to make unwise decisions? Do our patients have the right to make unwise decisions? And I used to use this example. Was diagnosed with Crohn's disease, and quite a long time ago now. And my consultant at the time, who's lovely, we got on really well. But I was on this, I'd been through loads of medications, and I was on this medication that helped the symptoms of Crohn's, but made me really poorly. Like, not really poorly, I was still in work, but I'd have like sore throats all the time, or sinus infections, and I was like, this surely can't be good for me. And he was like, Joe, you need it. And I was like, well, I don't want to take it. I'm not going to take it. I wasn't being awkward. My quality of life were rubbish. So I said, I'm going to try different things. I'm going to run a marathon, which I never did. And I'm going to eat healthy, and I'm going to quit the booze. And he was like, right, you don't really drink enough. It's not going to make any difference. I was like, I'm going to try. Well, so then I used to use that as an example in my training. I'd say, to me, I'm making a wise decision, but to him, I'm making an unwise decision. It's all about perspective. The amount of staff that afterwards would come to me and say, can I just have a quick word? I drank so much on Sunday night that like all these professionals would come in and telling me that they drink too much, basically. So I started to read around women and alcohol, and professional women and alcohol in particular. And it was just amazing what I found, basically. And yeah, so I became an alcohol transformation coach. I worked with, and I trained as a hypnotherapist. I use more coaching, to be fair. I use more coaching, and yes, I work with women who not really are drinking copious amounts, loads and loads, but as a society, we normalise unnormal, dangerous drinking habits. A bottle of wine a night, 70 units a week, and the impact on our physical and mental health is huge. So I work with ladies one-to-one. I don't really work with people one-to-one now. I don't ever advertise that. I get people come to me, and I then tend to take them on, because I always, because they're like, oh, so-and-so recommended you, and I really want you. So, but I run a membership for ladies that want to change their relationship with alcohol. Yeah, I'm trying to think. I feel so passionate about this subject, alcohol, and
yeah, it's quite interesting as well because just before we started the podcast, Tina and I had the conversation about how, especially in a profession like ours, it's easy to unwind with a glass of wine.
yeah,
And I know that certainly before the children came along, having a glass of wine or two every night was normal, and it was just, and even if I came home after a night shift,
oh yeah,
I'd have a glass of wine before bed because it's bedtime, even though
yeah,
it's daytime, but it is bedtime. And actually there are a surprising number of people who have their own relationship with alcohol but come to work with it and you don't know
yeah,
until you can smell it.
absolutely.
Yeah. And I think that you do often hear in nursing and other healthcare professions these ideas like, oh, God, I really need a drink when something stressful
Yeah,
happens, that phrase,
yeah.
but they don't mean a cup of tea. I mean an
No,
alcoholic drink. Or it just rounds the edges off, or it just gets me from daytime into evening. And Kate and I have recorded podcasts about work to home transitions so that you don't need to rely on those things. And a bit like yourself as a mental health practitioner, we know that alcohol is a crutch. It's just, or a strategy. It's just not the most helpful one we could choose.
yeah,
So I'm sure you do amazing work with people, Joe. But if you're sitting here listening to this and thinking, actually, it's crept from me having social drinking over a nice meal with friends to the fact that I am making sure I've got enough wine in the house to see me through the week, even if it's just a nightly
yeah,
glass, just have a think about that. Just have a think about that and whether you might need some support.
absolutely. And I think we do make it so easy for people to drink
Mm,
and to think it's normal
mm,
in our culture, and it causes so much damage. And I'm not saying at all there's anything wrong with having a glass of wine.
mm.
I think one of the difficulties with nursing and with other healthcare professionals, I'm sure, how sometimes you go home and when you haven't got anybody else in your family that's from the same profession, how do you explain to somebody what it's felt like if somebody you have found somebody hanging or somebody's been dying with the children sobbing around the bed, or it's a really difficult thing to portray and for anybody else to understand unless you've been in that situation, and unless you're there, it's not like a normal office job, is it? And how do you explain the impact of all that to people as well? So I think there's an element of that of
Yeah. And
but
there's
like
been
sorry,
sorry, no, there's things written about compassion and fatigue is more difficult for people who can't offload those feelings you're talking about, Joe, in another way.
yeah. And
Well,
I relate to that. I think in terms of, I think I was saying, I don't know if it was Kate that was saying it to her. If my husband's poorly, I'm like, oh, for goodness sake. I really have like compassion fatigue, definitely, because I'm like, oh, I haven't anything else to give. My children, I have so much empathy with, but my husband, I'm like, oh, really? And that's how I feel bad saying that, but it's true because there's only so much for you to go around, isn't there? And to be fair to him, he's amazing and has been wonderful when I've had Crohn's and when I've been in the hospital and stuff. And he's really like, so really, and he's very rarely poorly, but I'm like, oh my goodness. I don't say that, but I feel that. I feel a little bit irritated and annoyed, which I know that's awful, isn't it? But it is that what you're talking about.
and it might be sometimes as well, just going back to the alcohol slightly with the same topic though, is that you find it difficult to have the conversations without having had a drink first because almost in inverted commas, to loosen up a little bit,
Yeah,
to get
yeah,
it out, because we
yeah.
hold our thoughts, we hold our feelings, and sometimes we just need that so it all comes out.
Absolutely, absolutely. Yeah, and I think like what you were saying, Kate. I remember after, because we used to do a week of nights, 7 nights on and 7 nights off, and I remember going back to my house with my friend Jane. We'd done a week of nights, and we'd had a hell of a week with a particular patient, and it was really stressful. And I remember him saying, "Oh, when out day stuff goes, what's good." And I remember like, "Oh my God, it was a really tough week." And Jane and I went back to my house with wine at 8 o'clock in the morning after 7 nights, and sat and I think drank a bottle of wine each. And I remember I must have been at the time getting a sunbed delivered. Obviously, I wouldn't use a sunbed now, but I was getting one delivered. And we opened the door, and I remember saying to the sunbed man, "Oh, we're not alcoholics. We're nurses. We've just finished nights." So, like, I look back and think, what must he have thought? What must he have thought? And actually, after a really stressful week, and it had been a difficult week, probably going home and drinking wasn't going to help really at all in any way, shape, or form. But it was what you do, what you do.
And it's so interesting, Joe, isn't it, this conversation? Because I think there's our own personal relationship with alcohol at different stages in our lives.
Yeah.
But also there's like society's relationship with alcohol. So my husband doesn't drink.
Right.
Now, the number of times he'll have people almost insist that he drinks.
Yeah.
He likes, there's a 0.0 Guinness you can buy nowadays, and it makes him feel like he's, gone back to his youth. So he likes one of these. And people will go, but what's the point? Because it's got no alcohol in it. Or wouldn't you rather have the one with the alcohol in it? Or, oh, go on, just one drink. Or don't be a party pooper, which I find really frustrating, as if you need to, that will power your happiness or your being jolly. So it's really hard, isn't it, for people, because you've got this wider context of like the way society's relationship with alcohol is.
Absolutely, and I think that's a massive issue in our society in terms of, and how, you look at like all the politicians and stuff over COVID and Winegate and all wine and cheese, and we've normalised it so that it's okay to drink in work, for goodness sake. It's not. And I've worked with ladies on a regular basis who are drinking 2 bottles of wine a night and getting up in the morning and going to work. And that isn't uncommon. But actually, the impact on our health, and we don't really tell people that. People are not educated because we think, oh, well, all my friends drink a bottle of wine a night, it must be okay. And I think it makes people think about and question their own alcohol intake when somebody's not drinking. And so people do say, go on, have a drink, go on. But you wouldn't, you don't say that when somebody says, I've stopped smoking, do you? You say, oh, well done. You're not like, no, go on, go buy some fags. It's really crazy. And I genuinely think if alcohol came nowadays, it would be, a banned drug. Because
somebody made a great joke recently, which is you wouldn't do the same with lasagna to gluten-free people.
no,
You wouldn't go like, everyone must have lasagna, or go on have lasagna because you're being a bit boring if you don't. And it's quite funny, really, isn't it, when you think about it?
but the pressure that it puts on people is huge. And a lot of the ladies, even telling when they're maybe stopping drinking or reducing, or they're telling family, and they're like, oh God, I don't want people. And people's reactions are, like you said, you're stopping drinking, you're not drinking, really? Why? But even if they say, well, I'm having difficulty controlling it, they're still like, oh, you're not that bad, go on, have a drink. And it's irresponsible. It feels irresponsible. But by the same token, at the times in my life when I was probably drinking more, I probably did the same. And I think it's making you feel better. And it's only with education and, the amount of time and effort I've put into really understanding alcohol that actually you think, gosh, this is so dangerous. And, you know, we're seeing so many more people, aren't we, in A&E, in wards, with alcohol-related issues that, yeah.
So on the back of that, what advice would you give to our newly qualifieds who are coming into a stressful environment, and B, our existing nurses who may be feeling a little bit jaded, a little bit, God, oh my God, what would your advice be? Both as a, both as a mental health nurse loving what you do, and separately as an alcohol coach. Not an what is it? Not an alcohol coach?
Alcohol transformation
Thank
coach.
you.
Yeah.
I knew I was missing a bit.
It's all right. I think as a nurse, it's about being organised and having your priorities, but reaching out. You know, I think in nursing, it's always difficult. Whatever grade I've gone from and to, and the next one, I always think, oh God, I don't think I could do that role. I don't know what I'm doing. But actually you do, and it's okay. But it's okay to feel like that. I think in my experience, the nurses that are there that say, I'm amazing at what I do, I'm really, really good. And you do get those nurses, don't you, that are like, I'm really brilliant. Are the ones that you think, oh my gosh, you really need to go and have some clinical supervision or reflect on practice. So it's normal to feel like that. Reach out, get support, absolutely get support. Be honest. Don't say you know how to do something if you don't know. Even if you've been shown 10 times, it doesn't matter. Everybody learns in different ways. Whether somebody gets a bit impatient, it doesn't matter. Just keep asking. It's fine. Make notes, go away, come back to something. If you're really struggling, I think as well, it's about understanding your own goals, understanding your needs. Are your needs being met? Are you liking it? Is it just a bad day? Or is this being a bad week after week after week? Are you in the right job? Is it the right environment for you? Because everybody has bad days, and that's okay. And, you know, you talk about those patients that you can't get from your mind, because that happens to everybody as well. There's situations or there's difficulties, and you talk about that. You go get supervision. I'm a massive advocate for clinical supervision. I've always made sure I have it. And I know not everybody does, but to me, that safe space of being able to explore your practice is just crucial. In terms of if you're thinking you're drinking a little bit too much, I think educating yourself, so learning around what alcohol does in terms of, I mean, we haven't time to go into it here, but doing some research around what alcohol does in terms of anxiety, in terms of your mood, and how it impacts that long term, how it impacts your sleep. Track your units. I always think, because the amount of ladies that come to me and they'll say, right, I'm drinking probably 20 units a week, and of course we drink from home mainly now rather than the pub, so people are having a massive glass of wine that might be 5 units and they're saying it's 1. So it's about understanding where you're at, so buying some measures off Amazon, do them, or accurately tracking, getting an app tracking. And then thinking about what your goals are, but thinking about what you're going to replace alcohol with, because we're just taking it away but not replacing it with anything. So it's about understanding what it's doing as a sticking plaster, what is alcohol doing for you, and just getting honest for yourself and reaching out and getting support if you need it. You know, Instagram, Facebook, they all have amazing communities. Looking on there, finding people to follow who you like, getting support. It's your health, and just finding somebody that will help you, but asking for help.
Where can people find you, Jo, if they want your help in particular?
Well, they can find me on Instagram at sober.step, or on Facebook, joanne.tyler, Tyler. They can friend request me. Yeah, but you know, I always say to people when they first come to me, there's loads of coaches, and I won't go on, but I do feel so passionately about this. And you find it with alcohol. People can decide that they're not drinking anymore, go on a weekend course and call themselves a coach. It terrifies me. With alcohol, you know, you will know, Tina, we have to be so careful about assessing risk. For some people, it's really, you can't just stop drinking. We have to look at reducing and how we do that in a really safe way. And people just can call themselves coaches. So absolutely come to me. And if I'm not the right person, and I'm not for everybody, and that's fine, but I will help you. There's loads of options now. And even I try and do posts occasionally about what to look for, what questions to ask for in a coach, or because there is, I mean, one of the ladies that I work with now, one-to-one, she'd been in and out of rehab, and she had a coach before me. She drank all the way through. She had an hour a week with her. She charged 150 quid a week, and she drank all the way through. She'd been in and out of rehab, and she was just taking the money off her. And I'm like, oh. So there's some charlatans out there, so just be mad. And I don't even think everybody is a charlatan. Some people think that because they've changed, they can just help other people, and you can't. You need other skills as well. So, but yes, find me on @sober.step on Instagram. I've got totally off the question again. I'm sorry. I'm trying not to promote me too much. I wouldn't have said where you can find me if you'd not asked. That's all. So
don't worry, we will put it in the show notes for everybody as well. But it's good. It's good because that, like, if they see your posts and they kind of just can increase their awareness, you know, it's all good. It's all good stuff.
Absolutely.
So we're gonna have to let you go soon.
Yeah.
But before we do, what is really fulfilling nowadays about nursing for you, Jo?
Oh, do you know, for me, it has always been the patients. I love going on to wards and talking to patients and working with people and communicating. I think, you know, I think that's one drawback of nursing, is one of the ways that often the only ways you can move up is move away from the patients. And I kind of think we've got it all wrong, because actually the more experience you have, the closer you should be trusted with the patients, not the other way around. And I'm very fortunate that in my role, I can navigate that time with people. And that's what I love. And I really like people. I find people really interesting. Most people have got a story, and I think that's what I find fulfilling in all that I do. In every way, you know, my girls will go out and I'll go out with my husband and they'll be like, right, try not to talk to anybody today, Jo. Or he'll be like, Jess will be mad. Is that you as well?
Mummy, who are you talking to? Do you know them?
Yeah. Yeah.
And on that note,
thank you.
Well, this has been an absolute pleasure, Jo. Thank you so much for giving us your time. It's been amazing. It really has been fantastic to listen to you. And I know a lot of mental health nurses and a lot of nurses in general be really intrigued and really enjoy listening to your tips and everything. So thank you for sharing so much of yourself with us.
Thank you so much for inviting me and for having me on here. I really appreciate it as well.
No, you're so welcome. So you've been listening to A Live to Work with me, Tina.
And I'm Kate.
You've been listening to A Nurse's Live to Work with Kate and Tina. Please remember, this is not a replacement for medical treatment or help, so do seek assistance if you need to.
Thank you for joining us. Please do like, subscribe, give us stars, like and share with your friends and colleagues. All the good things.